Illinois.
And Mr. President, I ask unanimous consent that I be permitted to complete my remarks before the roll call.
Without objection.
Thank you. Mr. President, September 9th, 2021, over a year ago, was supposed to be an historic day in America's efforts to stop the purveyors of candy and fruit-flavored e-cigarettes from preying on America's kids. But September 9th, 2021 was the deadline, and it was set by a federal judge for the U.S. Food and Drug Administration to finally clear its enormous backlog of applications from e-cigarette companies seeking to sell their products in America. Companies that could prove that their vaping products were in fact appropriate for protection of public health, they could go ahead and sell their products legally. But e-cigarette products can't meet that standard. They can't demonstrate a benefit to public health. Vaping, as we know, is dangerous and addictive. And these companies, like the tobacco companies of years gone by, are preying on our children. FDA had a legal mandate to ban these products from U.S. markets on September the 9th, 2021. But the Food and Drug Administration failed to meet the deadline. Not by one day, not by 1 week, not even by 1 month. Last Friday marked the 1-year anniversary of the FDA's failure to meet this federal court order. As of today, the FDA has completed reviews of about half of these e-cigarette products that represent a large share of the market. As a result of FDA's inaction, dangerous, kid-friendly e-cigarettes remain available on store shelves without FDA review or authorization. The cops are not on the beat. There are consequences to this action. The Truth Initiative is a nonprofit consortium of health groups that aims to protect young people from using tobacco. It estimates that in the year since the FDA missed the court-ordered deadline to approve or reject e-cigarette applications, nearly 2.5 million kids in America started using vaping products. Many of these young people will go on to develop nicotine addictions with serious harm to their health. That's the human cost of this FDA failure. Now the FDA says, well, we might be able to finish this by 2023, 2 years after the federal court-ordered date. And that's not the only deadline the FDA has blown when it comes to protecting kids from nicotine. After parents and public health groups demanded the FDA take action against candy-flavored, nicotine-spiked e-cigarettes, the vaping industry came out with a brand new miracle product designed to evade FDA jurisdiction: synthetic nicotine. Products like Puff Bar, incredibly popular with middle and high school students. These new synthetic nicotine products included all the health dangers of traditional e-cigarettes, none of the regulation. When Congress learned about this loophole, we changed the law to say that the FDA had jurisdiction over synthetic nicotine products. To make matters worse, even when the FDA does review a product and issues a denial, many e-cigarette companies just ignore them. It's reached a point that they're not viewed seriously. The #1 regulator of food and drugs in America when it comes to protecting our kids from these deadly, addictive products isn't viewed seriously. The FDA has the legal right and the legal authority to do something. They can pull these products off the shelves tomorrow. And yet, with respect to illegal e-cigarettes, they do nothing. Nothing. Look, I understand they're understaffed. I understand they're under-resourced. FDA is not currently authorized to collect user fees for e-cigarettes, as it does for so many other products. And Congress fails to appropriate the funds many times that they need. These are real problems, but they do not absolve the FDA of its repeated failure to effectively regulate e-cigarettes. I'm at my wit's end when FDA continues to miss these court-ordered deadlines, fails to enforce orders, and shows a lack of urgency when it comes to vaping products. Last week, I asked Health and Human Services Secretary Becerra to step in. If FDA cannot or will not do its job, then it's time for the lead agency, Health and Human Services, to take a more active role. The FDA cannot continue to let unscrupulous e-cigarette companies flout the law and put their own profits ahead of the health of our kids. This has to stop. On a related matter, Mr. President, Congress has a big decision to make in the next few weeks. Every 5 years, Congress must reauthorize FDA user fee programs. These programs authorize FDA to collect user fees from companies they oversee, prescription drug companies, medical device companies. These fees help provide the funding that FDA needs for staff. In fact, almost half of their funding comes from user fees. But we shouldn't settle for a clean authorization of FDA user fees. We should give FDA the authority to collect user fees from e-cigarette companies, and we should provide FDA with new authority to protect America's health by better regulating the dietary supplement industry. I want to thank the members of the Senate Health Committee, especially its chairman, Senator Patty Murray, for including my proposal for better regulation of dietary supplements in the committee-passed bill. But I fear this common-sense proposal may be lost in the sauce in the closing days of this fiscal year. Many people are surprised to learn that today dietary supplement companies are not even required to register their products with the FDA. They aren't required to tell the FDA even the ingredients of their products. If you're going to put a product on the shelf in America, most Americans walking into that drugstore or that vitamin shop believe that there's been some government review of the product, some inspection, some standards. Not the case. When it comes to prescription drugs, they have to be proven to be safe and effective. Not so for dietary supplements. These products can hit the shelves and make outrageous claims and not be regulated in any way like prescription drugs. What our bill says is that each of the companies selling these products has to register with the FDA the name of the product and the ingredients in the product. So if something goes wrong and people start getting sick, we at least have the most basic information to protect Americans. The FDA is one of the most important agencies of the federal government. It's fallen on hard times. It is there to protect the health of families across the country, especially our children. Whether it's dietary supplements or tobacco or e-cigarettes, we need to make sure the FDA not only has the tools for the job, but uses them. Mr. President, I yield the floor.